Hello, I'm Peter Ndora. Welcome to this week's edition of Health Talk. And, well, you must probably be wondering what's coming up on the program. Well, we'll be joined by Kegeletso Tamae. She'll be sharing her story with us on how she was diagnosed with uterine fibroids. Find out what that is and what it's all about, because a lot of women during their lifetime sometimes get this condition. We then speak to a specialist obstetrician and gynecologist about these uterine fibroids and the impact on COVID-19. We'll also speak to the Acting Chief Director of Child, Youth and School Health from the National Department of Health about non-communicable diseases, otherwise known as NCDs, in children and young adults and the impact they have during this pandemic. A little later on, general practitioner joins us to give us advice on COVID-19 issues. Patients have been resorting to social media to try and get answers and share their frustrations about COVID-19 and how to treat some of the symptoms that they get at home. We'll get some advice from our doctor. Right, let's catch you up though with the latest COVID-19 statistics, and the person to do that is our senior producer, Zama Buthelezi. Zama, good morning.
A very good morning to you, Peter, and our Health Talk viewers. South Africa is fifth worst affected country globally in terms of coronavirus cases. Leading is the United States, recording more than 5.8 million infections, followed by Brazil at more than 3.6 million infections. India at number 3, more than 3.1 million infections, and Russia at number 4, approaching the 1 million mark. South Africa is leading also in the African continent with infections having passed the 600,000 mark. Let's take a look at the national COVID-19 statistics. As of the 27th of August 2020, more than 3.6 million tests have been processed so far in South Africa. More than 600,000 people tested positive so far. More than 530 people have recovered from the virus, but sadly, more than 13,000 people have since passed on from the virus. Looking at the infections in the provinces, 4 of the 9 provinces continue to report the highest numbers of infections, and these are provinces with big metros. Gauteng is still the epicenter of this pandemic, with Soweto, one of its biggest townships, leading with infection numbers. Let's take a look at these numbers. More than 208,000 people have tested positive in Gauteng. More than 111,000 people have tested positive in KwaZulu-Natal. More than 105,000 people have tested positive in the Western Cape. More than 85,600 people have tested positive in the Eastern Cape. Recently, the World Health Organization warned that we must learn to live with COVID-19, calling this a once-in-a-century health crisis whose effects will be felt for decades to come. But are people who have recovered from COVID-19 immune to the disease? Let's listen to the World Health Organization.
What we are learning about infection is that people do develop an immune response, and what is not completely clear yet is for how long, how strong that immune response is, and for how long that immune response lasts. There's very good data coming out from research studies which are being conducted all over the world that are looking at this immune response for people who have had a mild infection, people who have had asymptomatic infection, people who have had severe infection, and we're seeing that they do develop an immune response, that most people do. What we know specifically about immune response for SARS-CoV-2 is that there are a number of studies underway following the same individuals over time. These are called longitudinal studies, which follow the same individual at monthly time periods or every few months. Remember, we're 8 months into this pandemic, and so these studies are still continuing. From the longitudinal studies that are underway, not all of them are published yet, we do see a strong antibody response that stays at that same level.
While it looks like the following provinces are recording the lowest numbers compared to the provinces with big metros, the rate of infection is really picking up. Let's take a look at where they are. More than 36,000 people have tested positive in the Free State. More than 24,000 people have tested positive in the Northwest. More than 23,000 people have tested positive in Mpumalanga. More than 12,800 people have tested positive in Limpopo. More than 9,800 people have tested positive in the Northern Cape. We are on the second week of Level 2 regulations, and we reiterate the even greater vigilance and even greater care as more sectors of the economy are now opened and children are back at school. So remember to regularly wash your hands with soap and use sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers our nose and mouth. Every time we leave our homes, we must continue to practice social distancing and ensure proper ventilation indoors, especially as more people are going back to work. We must continue to limit our travel to only that which is absolutely necessary. So if you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Thank you so much, and back to you, Peter.
Zama, thanks very much indeed. Yeah, okay, so those are the numbers. And remember that as we observe and report on these COVID-19 cases, the numbers can change, sometimes quite significantly, as you've been seeing in the past few weeks. And remember, you can also be a part of the program, asking our guests some of the questions that you might have on your mind, or perhaps you just simply want to share your views with some of the issues that we'll be discussing during the program. And all you have to do is call the number that's on your screen now. It's +27 Johannesburg 714 5861 or 5877. That's Johannesburg 714 5861 or 5877. I'd love to hear from you during the course of the program. Okay, so here's a question for you. Do you suffer from heavy menstrual bleeding, menstrual periods lasting more than a week, pelvic pressure or pain, frequent urination, difficulty emptying the bladder, constipation, backache or leg pains? Well, there is a chance that you might be having something called uterine fibroids, and this could affect your fertility and may also impact your ability to carry a pregnancy successfully. Our question for you today is, do women know what to do to reduce the risk of getting uterine fibroids? Well, you can send us your voice notes or your video messages on our WhatsApp number, and that number is 065 862 4548. 065 862 4548. Try and keep your messages to under 30 seconds so that we can get through as many as possible. And you can also share your thoughts with us, of course, on social media. And our Twitter handle is @SABC Health Talk or #SABC Health Talk. And you can also find us on Facebook, and the Facebook page is SABC Health Talk. All right, so a lot to get through, a lot to unpack. Health Talk continues right after this.
In any crowd, there are those who save money on their car insurance with Outsurance and those who haven't yet. If you're one of them and they can't save you money, ask them for 500 Rand. But if you've been with the same insurer and claim-free for 3 years, tell them you want a massive 1,500 Rand. Savings or cash, you always get something out. SMS card to 44211 or call 08600 60,000 for a quote.
Wanna find great? Follow me. New listings. Whatever you're looking for, you'll find it on Yap. Yap has a range of great traders and suppliers. Those are our artists. Let me take you to the painters. There you go. All local, all vetted, and all-star rated. Find great on yep.co.za.
De Doorns was een rustige area toen ik nog een kind was. Mannen wat saam met my gehoord geraak het in dwelms verval. Ek is na in buis, ek het die pad gekies wat vir my veiliger is en dis om rugby te speel. Ek speel hier vir die local club, de Doorns United. SABC het my lewe baie verander as kind. Hoe meer rugby gekyk het op TV, hoe beter het ek geword. So dit my geleer wat 'n mens ek moet wees. Deur SABC 2 wat dit moontlik gemaak het.
Welcome back. You're still watching Health Talk. Now, about 20 to 80% of women develop fibroids by the time they reach the age of 50. Fibroids are most common in women in their 40s and early 50s. Painful and heavy periods, bloating and constipation are sometimes common indicators of women with fibroids. However, many young women ignore these symptoms because of a common misconception that fibroids only affect older women. Health Talk senior producer Zama Buthelezi spoke to Nozipho Diwati, who's a young woman who struggled with symptoms associated with fibroids. Let's take a listen.
After years of visits to physicians and relying on painkillers, Nozipho Diwati was about to find out what was causing her excruciating pain.
I have always been suffering from severe menstrual pains. And then my mom took me to the doctor to have me checked out. They thought it could be endometriosis. There was a bit of endometriosis, but there was also a fibroid, which were minor at that time. And I was told it's nothing major. They're not going to do anything about it right now, hoping that with time they will go away on their own.
Like many women, she had no idea what fibroids were.
I don't know what fibroids are. I've never heard of that, And I did do my research, and because the doctor tells you that no, it's nothing you should worry about. It'll probably go away on its own. You relax and you think, I shouldn't worry about it. Everything will be fine. And I went on with my life as normal.
The following year, after finding out she had fibroids, the pain became unbearable and Diwati had to go back to the doctor.
And it was in 2016, I think, when I went back. I went back to the doctor because my pains were just not getting better, And over the year, they had been doing checkups, and there was no fibroid. But that year, my daughter decided, let me do a laparoscope and actually see what's going on in there. And that's when they actually realized that the fibroid has grown as big as my fist. So it had to be removed.
While being operated on scared Diwati, being told that there was a chance that she might not be able to have children left her traumatized. Her journey of finding alternative treatment began.
I went to see my GP, who then told me that no, there's another doctor who does it a different way. You can contact him and see if he'll be able to help you. And that's what I did.
Okay. What was the procedure?
It was called embolization.
The embolization went well, and a year later, Diwati became a mom. She says that she is free from heavy menstrual pains, but she feels that not enough information is out there on fibroids.
Having fibroids is something that's also a major in a person's life. It's not something that's minor. It's something that could just change your life from what you thought it could be. So I think there should honestly be more awareness with regards to this topic.
That was Nozipho Diwati's story, and she had quite a journey. Well, let's speak to someone else who's also had a journey with fibroids, and we speak now to Kekeletso Tamae, who's sharing her story with us about this. And I know that a lot of you are busy watching this program and have heard that 20 to 80% of women will develop fibroids at some point in their lives. But the good news is that yes, that you will develop them, but they're generally non-cancerous. They're normally benign, so it's not something to be too fearful about. Just get medical advice and treatment. All right, let's speak to Kekeletso now. Kekeletso, thanks very much indeed for joining us. You had quite a journey with fibroids yourself. Tell us about the symptoms that you got that alerted you to go and get help from a doctor.
Okay, thank you very much, Peter. All the symptoms I had, abdominal lower back pain, I have severe constipation, I have heavy bleeding, and also the severe period pain.
And so when you went to see the doctor and they told you about fibroids, did you understand what that was and what that meant?
No, I didn't know. He had to explain to me, and I also went to do my own research. What is fibroids? Because it was for the first time in my life hearing something like fibroids.
I know it can be quite a scary thing to hear because you're dealing with growths, but the doctors spoke you through it and gave you treatment options. Tell us about that.
Okay, I went for sauna. I went to the clinic. They did the sauna, and the guy said, "No way, it was 20 centimeters." So they said, no, the only thing as a guy, we can just remove the womb, just go straight to a hysterectomy. Then I went back to the radiology department. They told me about the embolization. So I have to choose. It's either I go for embolization or I go for hysterectomy. But I decided to go for embolization because I didn't have kids at that time. So they explained everything to me. And I said, okay, I can try this one.
And that treatment worked, didn't it? Because you eventually did manage to get pregnant.
Yes, I have 2 kids now. It did work. Remember, in 2015, I went for my first embolization with that 20 centimeter. That was 2013. Then in 2015, I went again. Now it was 10 centimeter. Then I went for embo the second time. Then I think in 3 months again, I went again for the third one. Then it died. Then it formed something like a pus inside. So I went for a MRI. Then they did a scan. They said, no, the fibroid is dead, but now there's a pus, which is very dangerous. So they had to do myectomy and remove it. But after that, 100% living today.
All right, so you're healthy now. Thank you so much for sharing your story with us. I think it certainly gives hope to other women that this isn't something to fear. Get medical advice, get medical help, and there are options. Thanks so much, Kekeletso, for joining us on the program. All right, so we're going to take a quick break, but a quick reminder of our question today. Do you think that women know what to do to reduce the risk of getting uterine fibroids? Send us your voice notes or video call on 065-862-4548. You can also share your thoughts with us on social media via Twitter using our Twitter handle at SABC Health Talk. After the break, we'll be speaking to a specialist obstetrician and gynecologist about these uterine fibroids. Stay with us for that.
With the country's high COVID-19 infection rate, health conditions in prisons are under the spotlight.
As a result of the overcrowding, these inmates are prone to get infected.
We actually have been able to contain the pandemic quite well in these facilities.
We're sitting with a huge problem, and every day these people are dying. It's a grave humiliation to the human rights of the inmates.
Parole is a privilege. These are people who have committed murder, rape, very serious crimes in our communities. And ideally, you don't want such people being let out willy-nilly without a very due process.
This week on Trends Travel, we get up close and personal with news anchor Shante Yankees as she talks to us about her career and love for travel. As we wrap up Women's Month, we celebrate two phenomenal women who've made a mark in their respective careers.
God bless you.
And speed lovers, stay tuned as we get behind the wheel and burn some rubber with one of South Africa's top female spinners. For all this and more, watch Trends Travel this Saturday at 8:30 p.m.
Now, thousands of South African women are silently suffering the devastating symptoms of untreated uterine fibroids. These are muscular, non-cancerous tumours that develop in the walls of the uterus. And if left undetected, fibroids can continue to grow and cause increased symptoms, impact fertility, and potentially harm surrounding organs. Well, to talk to us a little bit more about fibroids and how to prevent them and treat them, we're now joined by Dr. Lusanda Shimange Matsose, who's a specialist obstetrician and gynecologist at the Charlotte Maxeke Johannesburg Academic Hospital. Thanks so much indeed for joining us, and welcome to the program.
Thank you very much for having me, Peter.
All right, so talk to us about these fibroids. I don't know that a lot of people know about them. Oh, I think we've lost Dr. Shimange Matsose there. We're going to try and call her back. But this is...
I can hear you.
Oh, you can hear us. Okay, great. Fantastic.
Yes, I can.
Okay, all right. So talk to us about these uterine fibroids. I'm not sure that a lot of people know about them until they get symptomatic. And sometimes you can live with these without symptoms, I believe.
Yes. So basically, fibroids are growths that occur in the womb, right, which is your uterus. And they're common in women of reproductive age. So basically, once you start your menstrual cycle and you have a potential to produce kids. But you can also find them in postmenopausal women because they grow over a period of time. And the other thing we know about them is that they're more common in your African population over your Caucasian population. And what you're saying is really true, that a lot of women are walking around with fibroids but may not necessarily be aware that they actually have fibroids, but they are very common.
So what should women be doing? I mean, is this something perhaps you should be doing as a normal check periodically?
You know what? It's one of those where a lot of women are asymptomatic, and up until they develop symptoms such as bleeding, possibly fertility failure, problems, or pressure symptoms, or pain, then they're not really aware that they do have them. Is there something that women should be doing? Outside of going for checkups, there's really nothing to prevent them. If you're prone to having fibroids, you're going to get them regardless. I mean, there are a number of studies where they looked at, is it a genetic factor? Is it a hereditary? Is it a dietary factor? Is it specific in terms of location and so forth? But if you're going to get fibroids, you're going to get them. It's just about recognizing them early enough in order for us to treat them. But even in the treatment, it's once they are symptomatic, then we would normally treat the fibroids.
All right, so let's talk about treatment options. What do you do?
So depending on what the
All right, we've lost Dr. Shimange Matsose. We're going to try and get her back just to talk a little bit about some of the treatment options. But I keep on saying, because I think sometimes when you hear the issue of having growths in your body, there's always that fear that it's cancer and that it's fatal. But most of these fibroids are non-cancerous. They're benign. Yes, you will get symptoms, but if you go to the doctors quite early, they can be treated and managed. So it's not something to fear, but something to understand and to get assistance with. All right, so we're going to take a quick break, and when we come back, we'll continue with Health Talk. Stay with us.
I have today signed a proclamation authorizing the Special Investigating Unit, the SIU, to immediately investigate any unlawful or improper conduct in the procurement of any goods, any works, and services during or related to the national state of disaster in any state institution.
Right, let's go back to our conversation that we were having just before the break, and we're joined once again by Dr. Lusanda Shimange-Matsose talking to us about fibroids, and she joins us now on the line. Thanks for coming back. We were talking about treatment options that are available to women with fibroids.
Yes. Apologies about the technological hitch, but just on the treatment, so it really depends what the woman presents with. So as I mentioned, if the problem is bleeding, we have to locate where the fibroids are. So in terms of treatment, we can either do medical treatment, or we can do radiological treatment, or we can do surgical treatment. So it really depends on the woman's age, their fertility desires, because an older woman who's completed her family may not want to actually go, let's say we remove the fibroids, might just want to have a hysterectomy, which is removal of the womb. Whereas a younger patient who has not even started a family might want to just remove the fibroids because she still desires fertility and therefore requires her uterus for that. So it really depends, and it's a conversation that you have with the patient in terms of their individual needs and the symptoms that they present with.
All right. So when you treat them, do they have a tendency of growing back, and then you have to keep on checking up?
So that's the one thing about fibroids is on the time during, let's say it's a surgical procedure and you remove the fibroids, about how many do you remove all the fibroids or do you just remove the problematic ones? In terms of growing back, there is a tendency, if you're prone to fibroids, there is a tendency for them to grow back. And this is the one thing that ladies must be aware of, that if you've gone, let's say, for an operation and they've removed all the fibroids, there's always those little fibroids which you don't necessarily see during surgery, which grow over time. As long as you're a woman of reproductive age and due to the hormonal factors, those fibroids will tend to grow. They may not grow to the same size as the original ones, but definitely there is a recurrence.
A little bit earlier on in the program, we spoke to somebody who had fibroids, and she talked about having a fibroid embolization. Tell us about that. What is that process?
So that is one of the treatment modalities that we have. It's a radiological modality, and the whole aim of it is to embolize, so almost like to block the blood supply to the fibroid. And the premise of that is if you're blocking off the blood supply, then there's nothing really feeding the fibroid, and those fibroids will basically tend to die off or shrink, if I can put it that way. So it is one of the treatment modalities that we do look at as an option.
A lot of women will hear you've got lumps and growths in your uterus, and these are not cancerous, though, are they?
So a majority of the fibroids that women get, they're generally not cancerous, but there is a malignant transformation in about 1% of the patients. And with those, it's normally your older patient, and it's a rapid growth. So it's someone who previously did not have any mass in their pelvis, and all of a sudden, through a short period of time, this mass grows and they present with anemia and heavy bleeding and so forth. Those patients, we normally think, okay, could this possibly be a malignancy as one of a differential? But the malignant transformation percentage is extremely low, but they can turn cancerous, but normally in your older patients. And that's quite important for ladies to be aware of that, because we get a lot of ladies where you tell them they've got fibroids and they, let's say, 32 and they think they've got cancer. That's not necessarily the case.
All right, okay, perhaps to wrap up, what's your best advice to women? I guess we've got to take the fear out of the equation, but what's the best advice in terms of preventing, if that's possible, and also managing, detecting and treatment so that, you can have fairly good health, even though that this is something that might visit you?
I think more than anything, in terms of preventative measures, I mean, there's really nothing like, I said in the beginning that it's just, if you're prone to them, but that is not correct, specifically from a pelvic point of view. If you feel that there is something that is bothering you, such as maybe
all right, Dr. Lusanda, we're going to have to leave it there. Unfortunately, we're struggling with your line and connection, but I think we've got the message. And women out there, if you're listening and watching to the program, get advice. It's good to get checked out and make sure that perhaps you are walking around asymptomatic, but may have fibroids that could be treated early. All right, we've been getting some messages coming through, and I think you've been using the social media platform. Let's take a look at some of the messages that you've put through. Caitlin says, abortion is personal for me. My mother's OB suggested that she abort my sister because of uterine fibroids that showed up on ultrasounds. The doctor believed my sister was deformed. Well, my mum bravely said no. She accepted the challenge, and my sister was worth it. Hashtag right to life. Okay, Bougie Black Girl says women, especially black women, don't talk about our fibroids. It's the whole stigma and shame thing about the female body. I thought, to heck with this, I decided it was time to talk about mine and my life after my hysterectomy. Thanks so much indeed for sharing that powerful message. The more we talk about things, the less shame is attached to it. So Ife says, so we still don't know what the cause of uterine fibroids is and why black women are more likely to have it than any other race. Yeah, Dr. Shamange said that, and sadly no real answer there. Dirty Computer, love the name. I'm having uterine fibroids removed on September the 1st. Okay. All right, so as many as 20 to 80% of women during your reproductive years, so right up until about 50, 20 to 80% of women can develop some fibroids. So that's something you really want to be cognizant of, and make sure that you get the checks and get the help that you need. Now, preparations are underway for the reopening of schools, and the mother of 11-year-old Madison Mulkin, who's living with diabetes, shares how they managed to keep the condition under control and how they've prepared for the reopening of schools amidst the COVID-19 pandemic.
People with underlying medical conditions such as diabetes might be at high risk of severe illnesses from COVID-19. And research has suggested that you are never too young to be a diabetic. Michelle and Madison Wilkins share with us their experience with diabetes.
Could you just kindly tell us about Madison's condition? When was she diagnosed and how old was she?
Madison was diagnosed at the age of 5 years, so that was in 2014. It was after a winter. She had a prolonged battle actually with the virus. They first thought it was bronchitis, and then it was just the ordinary flu. And then eventually, after 3 rounds of antibiotics, they tested her, and it came out that she was a type 1 diabetic.
Did you have any knowledge of what diabetes is and how you need to manage it from there?
At diagnosis, I had absolutely no idea. I'd always heard of the condition, but I didn't know what the symptoms were. I didn't know what the warning signs were. I had no idea how to manage the condition. So it took a week in hospital of intense training for me as a parent to get to know how to manage my child's condition, especially with her being very young. I needed to take control of it until she was able to, until she was emotionally mature enough to handle the condition herself.
Medicine, do you understand what diabetes is and how you need to manage it as a child?
When I was younger and I was diagnosed, I had no idea what it was. I didn't know what I had to do about it. But now as I mature, I understand more and more of it. I don't know everything, but I am learning more as we go.
When it comes to changing your lifestyle because of diabetes, you need to drastically change your lifestyle. How did that impact you as a family?
Obviously, with diabetes comes a compromised immune system. And again, it's not about bombarding an immune system to be able to function. It is about supporting that immune system so that it's functioning at its best.
Kids are said to be back at school. If she is back at school or she's doing homeschooling, how are you also preparing her when she goes to school?
We believe we are now at the point where it is time for her to go back, and she'll actually be returning next week, Monday. Her teachers are all very excited. We're very excited to reclaim part of our normal lives. We believe we have done the absolute best we can. We have given her immune system the best support, and she is now ready to go back.
I will adhere to all the basic rules like social distancing, sanitizing, wearing a mask. I've always been one to say that you shouldn't always share things, or if someone is sick, then rather stay at home, even when there wasn't COVID. So I've always been really good with my hygiene, and this wasn't even always when I was a diabetic.
All right, now, evidence shows that people living with non-communicable diseases, NCDs, are at higher risk of severe complications if they contract COVID-19. Now, while some children and infants have been sick with COVID-19, adults make up most of the known cases to date. Let's now explore if children with these common chronic conditions like hypertension, cardiovascular disease, diabetes, respiratory diseases, obesity and cancer are also at greater risk should they contract COVID-19. And to help us unpack that, we're now joined by Dr. Leslie Bamford, who's the Acting Chief Director, Child, Youth and School Health from the National Department of Health. Thanks so much indeed for joining us, Dr. Bamford. Always good to have you on the programme.
Good morning. Thank you. It's nice to be with you, and welcome to the viewers.
All right. So non-communicable diseases and COVID-19. We've talked about these mostly in the context of adults, but are children as vulnerable? We understand that COVID-19 generally is kinder to children, but what if they have these NCDs that present as comorbidities?
Well, certainly, as you say, in terms of direct effects, children seem to, for reasons that we do not entirely understand, are less affected by COVID. So we see fewer infections in children, and when children have infections, they tend to be either asymptomatic or much milder than in adults, particularly older adults. With regards to non-communicable diseases like hypertension, like diabetes, children with these conditions are definitely more susceptible to developing severe COVID. However, again, children are protected in that these conditions are actually extremely uncommon in children. So certainly, as we just heard, there are a small number of children who do have diabetes, and it is a condition that needs to be carefully managed in children. But if we look at the number of children with diabetes in South Africa, it is really much, much smaller than the number of adults who have diabetes. So remember, we have two types of diabetes. First is type 1 diabetes. That is usually the type that we see in children. And we don't really understand very well what causes it, but it's something of a random event. And some children are just unlucky and they develop type 1 diabetes. Type 2 diabetes is a disease of lifestyle. And that is the type of diabetes that we tend to see in adults, associated with obesity, and it is much, much commoner. And so most of the cases of severe COVID in diabetics has been in adults in type 2 diabetes. Likewise, conditions like hypertension, cancer. They do place children at higher risk of severe COVID, but they are extremely uncommon in children. The one condition that is relatively common in children is asthma. We do seem to have seen more cases of COVID in children with asthma, but these have tended not to be severe, and to date we are not aware of any deaths from COVID in children with asthma in South Africa.
All right. Sadly, we know that obesity is something that's kind of creeping into society, and we're seeing children and young adults bigger. And I just wonder if that is also connected to COVID-19 complications.
So we haven't identified that amongst children currently. The real danger with obesity in children is that it sets them up for problems much later in life. So I think COVID has been a wake-up call that unfortunately many of our children are on a trajectory where they are currently overweight, and we know that children who are overweight in childhood and adolescence often become adults with obesity who will be at risk of developing type 2 diabetes, developing hypertension. And there are many adverse health problems related to that, including now, of course, COVID-19.
All right, so we're in the midst of this pandemic, and one of the things that we have seen is that resources have been stretched, and also people generally staying away from hospitals. And I wonder if that's affected treatment, prevention of children with these NCDs.
So I think undoubtedly it has. We are very concerned about the indirect effects of COVID on children. We have seen fewer children coming to our facilities to receive preventive routine interventions like immunizations, fewer children presenting in our hospitals. And so we really are urging parents and caregivers to access routine care in our health facilities, whether that's immunizations for a healthy child, whether it's ARVs for a child who's infected with HIV, whether it's insulin for a child who has diabetes. Really the risks of not receiving routine care far outweigh the risks of acquiring COVID, and particularly severe COVID, in children.
All right, so I guess it's the same advice for adults in terms of making sure that we're healthy. We should be eating properly, healthily, to prevent some of these NCDs onsetting.
Absolutely. So as I mentioned, diabetes, type 2 diabetes, hypertension, they're really diseases of lifestyle. And if we can change our lifestyles, and for children make sure that we, from the beginning, they develop good, healthy habits, then that is the best way of preventing these conditions. So a healthy diet, exercise, not sitting in front of screens for prolonged periods of time. These are all things that assist us to be healthy, and in children are particularly important because they set up habits that these children are likely to take with them into their adult life and all the years ahead of them.
All right, Dr. Bamford, that's where we'll leave it for this week. Thanks so much indeed for joining us and sharing, as always, valuable information. Thanks for your time.
Thanks very much. Bye-bye.
Bye-bye. All right, that was Dr. Leslie Bamford, who's the Acting Chief Director, Child, Youth and School Health from the National Department of Health. After the break, we speak to a general practitioner who will be joining us to give us some advice to COVID-19 patients who have in the recent times been resorting to social media to share their frustrations and their concerns about COVID-19, and sometimes not always getting the best advice. So we'll get it straight from a doctor after this. Stay with us.
Igama lami ndingusindiswa. Igama leproject yethu Phaphama Community Project. Siye sikuthathele ipilisi. Senze sure uba uyasela. Umehluko mkhulu ngoba amaxhawazana lisaguli lo mhlobo ngoku. Iveke umhlobo wenene bayo project register kanjani. Ba besingamameli radio besingazi kwanto sihlela apha ezilalini. So umhlobo wenene sincede kakhulu. Ndifuna ukukama kwa SABC uthe inkosi kakhulu siyalibulela elithuba.
Welcome back. We're starting to wrap up Health Talk for this week, and this is the time where we start to help you with some of the burning questions that you might have. COVID-19, we're all waiting for a vaccine, of course, and some people are at home with symptoms and have been resorting to social media to get advice, and sometimes they're not getting the best advice, to be honest with you. So we have got a general practitioner joining us now to help answer some of your questions that you've been posting on these social media pages. And so let's join Dr. Marlon McKay to give us some advice. Dr. Marlon, always good to have you on the program. Let's get right into it. Let's see what the first question is. And this first one says, I was tested July 17. I was positive. I quarantined and symptom has stopped after 14 days now. Here I am again on day 15 and my body is aching and having symptoms again for 3 days. I think I'm reinfected, or I can't get reinfected that fast. Can I? Okay, that's from Daisy Howard. Dr. Marlon?
Yeah, sure. So it's unlikely to be a reinfection. In fact, that's still very, very rare. So we know with COVID that you recover in terms of time. That's when you're ready to de-isolate or come out of your room wherever you've been. But that doesn't necessarily mean that all the symptoms have resolved. And what we are finding now is that we have persistence of some of the symptoms, especially fatigue, can be body aches and pains, dizziness, fast heartbeat. So the reassurance, number one, is that you are not reinfected. The reassurance is that you cannot pass on the infection to anybody. You are not infectious. It's just going to take time, and you are not alone. I would suggest that you carry on with some of the treatment that you still have. But please rest and take it easy and allow your body to recover. Don't expect to be 100% the way you were just before you became infected.
All right, okay. And sometimes it takes longer for some people. Let's take a look at the next question. And the next question comes from Mazi, who says, I was diagnosed positive for COVID with pneumonia and shortness of breath, admitted into ICU for 2 weeks because my vital organs were losing oxygen and sugar levels becoming very high and very low. I couldn't breathe by myself for a full 2 weeks. I am recovering now at home and I feel much better. The problem now is that I can't sleep at night due to insomnia and anxiety. I'm afraid to sleep due to the trauma of what I experienced at ICU. Am I alone in this? How do you survive the trauma, insomnia and anxiety? Dr. Marlon?
Yeah, so this is such a great question, and we're seeing this a lot. The fear, I think, firstly, we become overwhelmed. The fact that you've actually survived such a harsh infection, the fact that you're in ICU, the fact that you had to be on oxygen, and the fact that you were probably so close to death, and now that you've survived it. And we're seeing the mental health impact that COVID has on one, where you're overwhelmed by anxiety, And yes, it can affect your sleep. You're scared to close your eyes. Am I going to wake up? And am I going to be okay in the morning? And I think a good tip is if you still have that pulse oximeter that you would have had when you were infected, that little device that goes on your finger to test your and that should give you an assurance that nothing bad is going to happen. You won't stop breathing. You won't get worse. You won't need to be admitted to hospital, and you will be okay. And as you see more and more that the oxygen levels are fine, the anxiety levels should subside. But you are not alone, and you are going to get better. So try not to be so anxious and try and get a good night's sleep.
All right. Thanks so much for that. I think a lot of people, a lot of it actually happens in the mind a lot in terms of trying to deal with this post sort of COVID symptom era. Okay, let's get the last few questions. Matapelo says, how to deal with shortness of breath, headaches and dizziness. This one comes up quite a bit as one of these prime symptoms.
Yes, absolutely. And it's probably one of the scariest ones because you have this shortness of breath, even with getting dressed, brushing your teeth, or trying to even walk. So again, I come back, if you have that pulse oximeter, that's a good indicator of whether your lungs are in trouble or not. But if the shortness of breath is getting worse, we do advise, please rather come in, see your healthcare provider. You may need an x-ray, you may need some blood tests to see if there's any secondary infection or if there's any scarring or damage to the lungs. Unfortunately, we are seeing some cases where there has been residual damage or scarring left over, which impacts your ability to breathe and the shortness of breath. So you're not alone, but sometimes we have to determine, is it something more serious, or can we just reassure you and say, don't worry, it will get better. And I think it's important to determine and to find out those who are more serious than the others.
All right, Marlon McKay, thanks so much indeed. And we look forward to another session with you in the near future. Thanks so much for the reassuring words and advice.
Thank you very much. Thanks for having me.
All right, so that's our GP, one of the ones that we have as a regular to help you answer some of the questions and the concerns that you have. All right, so that's where we come to the end of this week's edition of Health Talk. Thanks so much indeed for joining us. And for our guests, thanks very much for being on the program. But don't forget, the only way to manage this pandemic is if we all play safe. I know we're at level 2 and a lot of people enjoying themselves, but please, stay at home as much as you can, social distance, wash your hands, and please wear a mask. Bye-bye.